We have today with us Dr. Vardhan, the Union Health Minister, to talk about the goals and challenges towards the nation in the coming time. Thank you, sir, so much for talking to DD News. Sir, you have already served in the field of health. Now, what are the goals and what are the challenges? What will be your first step which you will take?
You see, you can't think of doing something first and then doing something second, but obviously the first things first principle always applies. But in the field of health, you have to start working on all the fronts simultaneously, because there are so many problems. Children have different issues, women have different issues, senior citizens have different issues, youth have different problems, and every problem pertaining to the field of health is very important. The WHO's goal of providing health for all by the year 2000 has actually, you see that we are already quite late in that. And in last so many years, we have eradicated 2 diseases, and most of the new other diseases are emerging, like non-communicable diseases. We have the emergence of heart diseases in a big way. Even young people are getting heart attacks. So you have to do something very strongly for prevention of heart diseases. Right. You have to promote the culture of doing exercises, morning walks, healthy diets, healthy foods. Diabetes is becoming very, you can say, prevalent in the society, and it's a lifestyle disease. It's a disease no doubt controlled with heredity also, but something which is in a way with minimal treatment preventable, to that extent that if you change your lifestyle, if you change your diet style, then maybe you can prevent diabetes. So you have to think of doing a huge stop diabetes program in this country. Still, after so many years, you have almost 30–40% children who are not getting vaccines in the routine immunization program. So you have to strengthen the routine immunization program, make sure that each and every child in this country at least can be saved from the menace of a vaccine preventable disease. He should have access to vaccine at the nearest, you can say, immunization center, and there should be enough education in the society for the mothers to ensure that their health is also important, their child's health is also important.
You are talking about women and child and children the most. That shows that you have a special place for children in your heart. So any 2 things which are very close to your heart that you want to do on the priority basis?
You see, I feel that best attention has to be given to children, because they could be the strongest possible messengers of health in the society. I have the experience of polio eradication, and I saw that millions of children in this country, they became polio sanics, they became the messengers of polio eradication movement, and a lot has to be done for them. You see, many of these children may be suffering from malnutrition, they may be suffering from anemia, they may be suffering from deafness and various other ailments which go undiagnosed, because sometimes the children are not able to tell what is their problem. So there has to be a development of a specific program for, say, early diagnosis of deafness, for example, early diagnosis of various diseases. If we have vaccine for measles, and if we can actually eradicate measles, and if the children are dying in the capital because of measles, I think that's a sad and shameful situation for the country. So programs for eradication of measles have to be strengthened, programs for eradication of leprosy, filariasis, for control of malaria, tuberculosis, giving positive health education in a big way through schools, through colleges, prevention of tobacco control, you can say tobacco related illnesses, and then making people quit smoking, shedding off their habit of taking alcohol. We have to work for environmental related diseases, occupational health related things. We have to work for ensuring that our maternal mortality rate goes further down and it is able to live up to the expectations of the Millennium Development Goals. Our infant mortality rate has to go down, and basic thing is that preventive strategies and strategies related to positive health attitude development in the society have to be strengthened and converted into a big social movement. If we are able to do that, there may not be need for hospitals and dispensaries, but certainly if somebody gets a disease, we have to ensure that we have good facilities at the primary health care level, we have good primary health centers, we have good district hospitals, and if somebody has to undergo a complicated disease like maybe coronary artery disease where he needs a bypass, then we have to have institutions like AIIMS and the tertiary care centers in this country. So, we are going to work on a detailed, comprehensive, all-inclusive sort of program, whereby we involve the health professionals, we involve the health paramedics, we involve the NGOs in the society, we involve the various departments of the government to convert health into a big movement. And it is possible that as soon as we involve all these institutions into this activity related to health prevention, we can be inching closer to the goal of health for all, because the dimensions of health have changed now. It is not simply giving a medicine and treatment by a doctor which is health. We have to see that the components of health like the physical, mental, social, psychological, spiritual well-being of an individual. It is basically all these components which have to be taken care of. We have to take care of the body, we have to take care of the mind, we have to take care of the soul, we have to see that the mental health is also taken care of, the physical health is also taken care of. All India Institute is also taken care of, and a primary health center in a village is also taken care of. And if Delhi can have an All India Institute, then every state should have an All India Institute of Medical Sciences.